Welcome. I'm Allison McKinney-Tim, founder and executive director of Justice Revival. Justice Revival is a diverse, inclusive community of Christian faith dedicated to serving as a voice for human rights in the United States. And you can learn more about us at justicerevival.org. I am joined today by Fran Quigley. Fran Quigley is clinical professor of law, and he directs the Health and Human Rights Clinic at Indiana University McKinney School of Law, no relation. Students in his clinic advocate for the rights of the poor with a special focus on barriers to accessing healthcare. Fran is author of multiple academic articles on social justice and human rights. He's also co-founder of Faith in Healthcare, and he edits its newsletter. Check it out at faithinhealthcare.org. Fran likewise contributes to publications of the Religious Socialism Working Group of the Democratic Socialists of America. His most recent book is entitled Prescription for the Poor, an activist's guide to making medicine affordable for all. He also has a forthcoming article entitled, Tell Me How It Ends, The Path to Nationalizing the U.S. Pharmaceutical Industry. A warm welcome to you, Fran.
Thank you, Allison. It's terrific to be with you. Thanks for the invitation.
And we're here, of course, today to talk about the human right to healthcare, an area of deep expertise for you. And this conversation happens in the context, of course, of the growing spread of the novel coronavirus in the United States and around the world. We're both here talking from our home offices, as it were, following the calls to social distancing. But before we turn to coronavirus, I want to ask you to share a little bit more about your own background. And can you tell us what inspired you to come into the field of health law and to build a platform in faith and healthcare that addresses the human right to health from a multi-faith perspective?
Yeah, thank you, Allison. It's actually kind of an interesting path in that I do not have a health law or health background of any kind. I'm not a master's of public health. I'm certainly not a physician or a nurse practitioner. But I'm a human rights lawyer, and I worked as a public defender. I worked as a civil rights lawyer domestically and did some international work. But what I found in advocating for my clients in the criminal justice system, or their right to access the right to vote, or to have their free speech rights protected, that ultimately there was no escaping the hierarchy of needs, as it were, that folks who couldn't get access to the medicines they need, folks who couldn't get access to the physicians or the procedures that they needed to survive and to live a healthy life, all of those other rights were going to be secondary. All of those other rights were not going to be exercised. As you know, in human rights, the term is interdependence, that the right to free speech, the right to vote, the right to express ourselves as citizens is wonderful. But if we are going to die because we can't afford our blood pressure medicines, or can't afford the asthma inhaler, or get to the physician or nurse practitioner when we need to, those rights can't be exercised. So circumstances and what my clients struggled with is what drove me to being more of a access to healthcare advocate. In answer to your question about the faith community involvement, is that, and I'm sure your viewers already know this very well, is that in the great social movements of our time and before our time, we talk about the civil rights movement or the anti-apartheid movement or the women's suffrage movement, faith organizations, faith communities, faith congregations were always leading actors in those movements. Faith organizations have structure. Faith organizations have a place for people to come together. But very importantly, maybe most importantly, faith communities have a moral message. And this is a moral question. We must provide care. We must make sure that everyone has access to the basic necessities of life that include healthcare.
Thank you for sharing that background on on how you've, through your firsthand experience with clients, seen the interrelationship and interdependence of various kinds of human rights, including the human right to healthcare. And we'll be talking more about that. I want to touch on what's really top of mind right now, we know for most of us at this moment, and that's the growing coronavirus pandemic. And in the United States particular, can you reflect on what this moment is illuminating or clarifying about the healthcare system, the public health system in the United States?
Yeah. Unfortunately, I think it's illuminating that we don't have a sufficient public health system. And what we do have more than any other nation in the world is we have a for-profit healthcare system. We have a system that does a terrific job of generating billions of dollars of profits for health insurance corporations, for pharmaceutical corporations, and that we have a system that, as again, unlike any other system in the world, that puts that front and center. And that what do we develop particular medicine because the question is going to be, is it going to make somebody some money? Do we manufacture sufficient protective equipment for healthcare providers? Well, is there a market for that in the short term? Do we keep enough hospital beds to respond in the case of a pandemic? Well, maybe not if it's not going to let that hospital system be profitable in the short term. So we have prioritized profits. And as a result, I think, unfortunately, we're seeing how vulnerable that has left us. We spend more dollars per person on healthcare, not just in any other nation now, but than any other nation in history. Yet we are so much less prepared than other nations to respond in this public health crisis, in this pandemic. And that's because we have done a great job of making a lot of money for a few out of our healthcare system, and we've done a very poor job of making healthcare accessible for the many, and to create a public health system that's going to respond well in a crisis like this. So unfortunately, this is not a surprise for people who are low income, for people who don't have health insurance coverage. They've been struggling like this for a long time, but the rest of us are seeing the unfortunate end result of the way we have prioritize profits over people in our system.
So some of the specific pain, if you will, that people in this country will feel during coronavirus due to things we've been hearing about, shortage of hospital beds and ventilators and even supplies, and the economics of how vaccines or treatments get developed. Those problems that we're feeling right now in coronavirus, those are reflective of this broader systemic problem you're naming about the profit, the ills of the profit structure in our system.
Yes, I think that's very clear. If we had prioritized public health, if we prioritized access to healthcare for all in the last 10 to 20 years, we would have maybe developed a vaccine. Because we didn't develop a vaccine because it wasn't seen as in the past, it certainly would be now, as profitable for a private company to take public research and develop it. We haven't, hospitals have closed, especially rural hospitals have closed at a time in the years leading up to now where we could use every bed we have available. We didn't have enough of a inventory of tests, of ventilators, as you say, et cetera, because that wasn't going to be profitable. We're looking at budget-minded choices, and instead of what's best for the people, what's best for preparing for a pandemic, but what's best for the anticipated public health crisis that many experts have said is coming down the pike. We weren't ready, and we weren't ready because none of this was going to make some folks money in the short term. And that's the way we structure our health system in the United States, and it's unlike any other nation. And in some ways, that's the biggest reason why other nations have oftentimes done a much better job of responding to this crisis than we have.
You made a very interesting point in your recent article that was co-published on your website and in Sojourners magazine about the government funding that goes into development of new medications through, for instance, the National Institute of Health, but how that government-funded research then gets transferred to a private company that can develop a monopoly through a patent. Can you talk a little bit about that? And is that going to be a risk with a coronavirus treatment as well?
Yeah, this is we engage in what some people say is the government paying twice for drug development, and some people say that the government acts as a very dumb venture capitalist, because what we do is we, the people, through the National Institutes of Health in the U.S., but other nations do the same, is that we, the taxpayers, will fund the earliest stage, the riskiest stage, the most difficult stage of drug medicine research. And what we do, thanks to a piece of legislation from 1980 called the Bayh-Dole Act of 1980, we then hand over, when there is a promising compound identified, we hand over the rights to a private company to develop it. And the rights are not just permission to develop it, but a monopoly right of at least 20 years, a patent monopoly. And a patent monopoly on a successful, important medicine means that the pharmaceutical corporations can charge essentially whatever they wish, because it's life or death equation for the people who need that medicine. And it's why the pharmaceutical industry, this is a terrific business model for them. They're the most profitable industry in modern history, but it's not a good model for public health. And on the back end, we actually, we the people, again, taxpayers through the Medicare program, Medicaid program, et cetera, we purchase those same drugs we pay to develop, that we gave a monopoly patent on, and we purchase it at inflated prices. And to answer your question about the coronavirus, it's absolutely a risk, because again, the same pattern has been followed, that the taxpayers have paid for the early stage research and identified some promising compounds. We are potentially going to let private companies have monopolies on those vaccines. The Secretary for Health and Human Services recently told Congress he could not promise that the vaccines would be affordable because the private companies would get to decide that. And again, if the private company had created this from scratch, had done this work without government support, without taxpayer support, that may be more understandable, but it's not the equation. The equation is we've done the work, we've developed this medicine, our system just prioritizes handing it over in a monopoly. And that's increasingly become unacceptable to Republican and Democrat lawmakers alike, and certainly the people. The people, poll after poll show that people say that we the public need to keep control over this medicine process that we're paying for.
So is there a movement that's working to change that particular shortcoming or failure in our system?
There really is, and frankly, it's a movement that is fueled by, even before the pandemic. In poll after poll, Allison, the respondents have said that they want the number one priority for Congress and for the president is to deal with drug prices, because not inability to afford insulin, inability to afford asthma inhalers, cancer diagnoses putting people into bankruptcy based on the medicine cost of sometimes hundreds and hundreds of thousands of dollars a year. People can't afford that. Even people who are upper middle class and below can't afford that. So that is the number one political priority, and that has led to Republican and Democrat proposals for really significant reform. I think that a rational look at the system means we need to essentially change completely the way we do it now, but even small reforms would be helpful. So yeah, there's a lot going on.
And let's talk about another problematic aspect of the US system that I know that you've spoken about in the past. Tell us, what does it mean that healthcare, health insurance is tied to employment in the US? What are the effects of that? What do you see as anticipated effects of that during this pandemic in particular?
Yeah, it's well, we can look at it two different ways. One, you look at the sheer numbers. 27 million people in this country are uninsured. Another 13, 14 million have insurance through their workplace, but they can't really afford care. The deductible's too high, the copay's too high. They struggle to pay the premium. But we can also look at it in a less abstract way. The article you mentioned that was published in Sojourners starts off with a meeting I was at just last week where workers here in Indiana We're talking about not being able to afford insulin, not being able to afford asthma inhalers, not going to the doctor, not getting a test done on a suspicious mass of breast tissue. A woman who's at risk of having breast cancer wasn't able to afford her tests. Other people were going without food so they could pay some of their medicines. Here's the thing, every one of those persons had health insurance. They had health insurance through their job, but the copays and deductibles were so high that they were still going without care. So it's also, it's been it's a huge problem from the worker perspective, but you also hear folks from the business perspective saying this is not what they want to spend their time, energy, and dollars on, is trying to provide healthcare at an increasingly high cost to their employees. And so if your folks are, your viewers are interested, there's a terrific free film online called Fix It, F-I-X-I-T, Fix It. And it is the business case, the business owner's case for a universal healthcare system like a Medicare for All system. And it is produced by a business owner in Pennsylvania who has since founded an organization called Business for Medicare for All. It's also co-produced by a former health insurance company executive. And the argument is that that's not what the businesses want to be doing. They want to make sure that their employees have health care, but they don't want to each year try to negotiate a better healthcare policy when their premiums go up. So they struggle from the business perspective. It also, of course, prevents people from going off and creating their own businesses and being entrepreneurial because someone in the family is trying to hang on to a job that has a decent health insurance plan. Again, that's not the norm in other countries. They will have a government-run program like we have for Medicare or Medicaid, but everyone can get access to it.
So we actually have some distortions in our labor market based on tying the access to health insurance to employment. It impairs mobility. It might impede entrepreneurship and has some broader economic effects. Fix It sounds like a great resource, and we'll link to that in our notes for the interview.
Okay, wonderful. Yeah. And again, just competitiveness on the global stage is that Warren Buffett is the one who said that healthcare is the tapeworm of the U.S. Economy, because U.S. businesses that want to compete with a Canadian business or a German business or a Japanese business, U.S. businesses are paying more for healthcare for their employees. They have mandated to do so in some cases, and they're struggling with this unpredictability of the costs. And that's really weighing down the U.S. firms' ability to compete with firms in other countries, which have frankly figured out healthcare better than we have.
So hearing you talk about the deep systemic failures of our system, that really seems to call out for an answer to the question, why haven't we been able to improve the system politically, sociologically? What's hampered the U.S. from creating a system that's more like its peer countries and that ensures broader access to healthcare?
Well, part of it is historic. In the U.S., we created our employment-based healthcare system essentially in World War II, and shortly thereafter, where employers were trying to compete under a wage control situation. They couldn't pay you, Allison, a higher wage than someone else in your position at a different company, but they could compete by saying, here's a better health benefits package. So we created a system in the US where health insurance in particular was tied to employment. And that wasn't the case in the UK. It wasn't the case in Canada and other places. So they were able to transition to a government-run healthcare system more easily than we have. And then, of course, what's happened now is that there's a lot of very powerful interests making an enormous amount of money on the status quo. And when you have billions and billions of dollars of profits going to health insurance companies and pharmaceutical companies, they then can divert some of that money and due to political campaign contributions, to lobbying. They're reliably at the top of the list of lobbying expenses and campaign contributions to keep the system the way that it is. And again, you can understand that from their perspective. But for our perspective, as what's best for the people of the United States, we need to overcome that resistance and embrace a change. And a change is always hard. There's going to be some transition period and there's going to be some short-term costs, but we absolutely can have universal coverage for everyone. The numbers have been crunched many, many times by economists. We can make sure that everyone has all the healthcare that they need without copays, without deductibles. at a cheaper cost than we have now if we just get rid of the monopoly markups, if we get rid of the health insurance company billions of dollars of profits, the tens of millions of dollars of CEO salaries, et cetera. Those are inefficiencies in the system that we need to eliminate. And it's going to be hard to do that politically, but what we must.
And we might see, perhaps we'll see intensified political incentive to try to fix those problems, because we know that right now, people in this country aren't even guaranteed that they will be able to access treatment for COVID-19. We know that the president misspoke when he said that treatment would be available at no cost, when in fact it's only the testing that is made available without copay. What do you anticipate the effects to be in the near term with this growing pandemic, and with the prospect that not everyone will be able to afford care if they fall ill?
Yeah, we already see that happening. There's always a few examples out there, even in this short early stage of the crisis, that we have folks who did get treatment and then were faced with a bill of tens of thousands of dollars for the treatment. The testing, of course, is free. The treatment, it very much is not. And so we're going to see that. It's going to, I mean, I think there's reason to hope that we can use those examples to keep pushing for a Medicare for all type system, universal healthcare system. But I do think this is something where the faith community has a really important role, because we can and should raise a moral voice to say that this is unacceptable in a country as wealthy as ours, in a country where we are committed to treating people well and to respecting human rights. To have folks not go to get care because they're afraid of getting that unpayable hospital bill, of folks getting a hospital bill that's going to put them into bankruptcy or have their already small paychecks be garnished. There's a moral question there. I actually have written about it, and folks can find it on Faith in Healthcare, and I wrote it about it in Sojourners as well. But the Canadian healthcare system actually has, which most folks probably know, as a universal healthcare system. It has very strong roots in the faith community. Most admired Canadian by poll after poll in Canada is a man named Tommy Douglas. Tommy Douglas was the premier of Saskatchewan, essentially like a governor of a state for us. And Tommy Douglas was the one who pushed through a universal healthcare system, a government guaranteed Medicare system in Canada. And he did so based on his own background in the social gospel, as a social gospel adherent as a Baptist minister. He started his life as a Baptist minister before going into politics. And the faith community was a really important part of creating the political will to create the universal healthcare system in Canada, where people don't go without care because they can't afford it, where people do get medicine that need it. People don't go bankrupt because they had a health incident in their families. Wow. And faith advocates still to this day say that what they consider the Canadian system to be is the Good Samaritan writ large. This is the community stepping up and caring for folks who are sick and injured in a way that individually, of course, we can't all do.
That's a great point. Individual charity is not sufficient. There's a need for a broader systematic approach. And if you're drawing a parallel between the US and Canada, do you see potential for a faith-inspired social movement, or a role for voices of faith in a social movement that could achieve a similar objective here?
I do. Almost every faith denomination has a pretty strong policy statement or resolution in favor of universal health care. I did write a piece for Faith in Healthcare last year that went through and went through what the United Methodist Church says, and what the Presbyterian Church of USA says, and what the Reformed Judaism movement say. In almost every instance, there's a pretty strong statement there about universal healthcare being a moral mandate. What we need as people of faith is to push that up the priority list in our congregations.
And I found that to be a very useful article, the one that you just mentioned, where you chart the positions that a number of traditions have taken on universal healthcare or Medicare for all. And that that also makes me think of the social creed for the 21st century that the National Council of Churches adopted, that acknowledges economic rights and also refers back to the social gospel movement of the early 20th century, which you mentioned in reference to Canada. So if we're thinking about new paths forward and how to address these problems you've been describing and the role that people of faith can play, let's also bring in the idea of human rights here. And can you reflect a little bit about what it means to talk about a social good like healthcare as what we would term a human right?
Right. Well, you know, of course, as an experienced human rights advocate, Allison, that is an incredibly non-controversial point to make in any place but the United States of America. The rest of the world has signed on to economic and social and cultural rights as being human rights on par with the right to free speech, the right to participate in the democratic process, and has embraced the idea that these are interdependent, that if you don't have enough food to eat, if you don't have medicine available to you, it doesn't matter that you have the right to free speech. We have to have these things together. So the rest of the world, if we talk in terms of law professor talk, is that the rest of the world has signed on to the International Covenant on Economic and Social and Cultural Rights and said that we do embrace a right to health care. We do embrace the right to the highest attainable standard of health, and that most national constitutions around the world explicitly say that there is a right to health care. Even the US has signed on to things like the World Health Organization Constitution, which explicitly talks about the right to health care. We have signed on to the International Covenant on Civil and Political Rights, which talks about a right to life, which is a little bit different than what we usually think of in terms of the abortion context in US political discussion. The right to life internationally means the right to survive. And the right to life, of course, means that if we need asthma medicine in order to not have an attack that lands us in the hospital or potentially kills us, that we have a right to those things, and that the state, we acting collectively, we the people, need to ensure that everyone has access to those things. So that is a human right very clearly across the globe. In the US, we're a little slow in adopting it, but I do think that the potential silver lining of this very dark cloud of the coronavirus pandemic is that we're starting to realize that we're all in this together, and that without health, all those other rights that we cherish are not going to be valuable to us.
So if we were looking at that International Bill of Rights, which is something that we do at Justice Revival when we're doing human rights outreach in congregations, we see we're part of the civil and political covenant, but we're not fully part of the covenant on economic and social rights, despite what you've described in such a compelling way as the deep interrelationship between these rights. When you're thinking in terms of the moral case for human rights, is there more that you would want to add about foundations for the idea of a human right to healthcare that you find in your own religious tradition or in other religious traditions that are supporting this growing faith movement to think about universal healthcare as a human right?
Yeah. Well, I myself grew up Roman Catholic, and I attend a Methodist church now, so I'm squarely within the Christian tradition. And again, anyone with the passing familiarity with the Gospels understands that if Jesus had a vocation, it was as a healer, right? He was providing free healthcare all across the countryside. And certainly many of the parables, including the Good Samaritan parable, of course, were focused on providing care for those who are sick or injured. But what I've really enjoyed is being a part of these multi-faith efforts with Faith in Healthcare and the Religious Socialism Working Group is that how universal these mandates are, that our Jewish brothers and sisters have the same scriptural mandates, that our Muslim brothers and sisters have the same scriptural mandates. And I've really enjoyed the process of interviewing folks and writing about them for our newsletter and for Sojourners and others. And I do hope that this will eventually be a book, just to show that all of these folks who are acting within the mandates of their faith traditions, even those traditions by name are so different, what they are told to do, what we are told to do is the same. And again, it's exciting to think about the power of a multi-faith effort to come together and say, this is how the United States needs to reform. We do need to ensure healthcare for all, because our own scriptural mandates, our own sense of morality demand it. And that's what I found to be essentially universal across faith traditions.
Mm.
And if I could, I'd add one other thing, Allison, is that the faith community really deserves credit for walking the walk, because of course, Christian organizations have been providing healthcare around the world for generations, but also the world's first charity hospitals were Muslim hospitals. The Jewish community has done an amazing job of providing free healthcare. So the faith communities have walked the walk in many ways, and really gives the faith communities a real moral authority to speak on that. We are providing healthcare as we can charitably. That's not enough. We need to have a systemic, broad, community-based solution to the needs. And so I think faith communities have a real standing, if you will, to make the demand that we need to do better in this country.
Do you see a role for faith communities to play in broadening the base of support for this issue? Because when we talk about healthcare as a human right in the US, you articulated so well how anywhere else this would be well accepted, yet in our country, we really hear these conversations more on the Democratic, or exclusively more on the Democratic side of the aisle. But can this, or should this, be more of a bipartisan effort? And what role can faith play, if so?
Yes, I think that it can be. And I think that Allison, I think that we have reason for optimism that it will be a bipartisan effort. We do see folks on the Republican side of the aisle embracing the idea, for instance, if they're opposed to the Affordable Care Act, well, we'll replace it. Not that we're going to get rid of government health care. We'll replace it, and replace it with something better. Now, the specifics have been vague at best, but at least the rhetoric is there. And I'm not surprised the rhetoric is there, because the public opinion polls have shown, and I think when we just talk about it with our friends and family, we'll see most people do embrace the idea of a right to health care, and we understand how important that is. And polls have shown that even Republican respondents are saying that they believe that there is such a thing as a human right to health care, that we do need to have guaranteed health care for all. And I do think elected officials, of course, are going to follow the will of the people. Otherwise, they won't be elected officials anymore, right? So we can make that known. And of course, the faith community has strong roots in both the Democrat and Republican parties. And many people who are persons of faith who consider themselves Republicans, I think, have a terrific opportunity to encourage their lawmakers and their party to embrace this as a moral mandate, that this is something that we need to do, even if we're going to have different party perspectives on some other issues. Healthcare for all is something that I do think both parties and all people can get behind.
What's one way, or a couple of ways, that people can be part of this effort? How can people take action if indeed they want to join the struggle and support universal access to healthcare?
Yeah, well, I think that I think it does start within our own faith communities, because us as an island writing a letter to our representative or our senator is great. There's no reason not to do that, but that's not nearly as powerful as an entire congregation coming together and asking their member of Congress or their senator to take a position, or advocating for something within their own state. And again, as we mentioned, most faith traditions can trace back both in scripture, but in more recent policy statements, some real strong foundations for us to say, we want there to be guaranteed health care for all. We want there to be free medicines for everyone who needs them, etc. So I would encourage folks to look in their own communities, in their own social justice committees of their congregations, and see, can we make access to healthcare a priority? Because sometimes committees are doing terrific work. There's a lot to be done. Sometimes they're focused on charitable outreach in the community, which of course is incredibly important. but we have a real policy voice that we can raise as people of faith. And so if folks want resources, our faithandhealthcare.org website, which you were kind enough to mention, has my contact information there. I'm happy to share some resources and connections. And as I did mention, the Religious Socialism Working Group is intentionally multi-faith as well, which is embracing the idea that this in particular, in terms of healthcare, is something that the private sector has not done well. The for-profit motive has not succeeded. We could have profits, a market-based system for getting big screen TVs or getting a better internet connection for me right now, or to make cell phones, that's fine. But healthcare is a human right, and healthcare is an absolute elemental part of our survival. And we can't put a price tag on that. We have to make sure that it's like public safety, like it's like law enforcement, like firefighting, like our infrastructure, like our public schools, that we have to make sure that that's available to all. And putting a profiteering aspect to it, it's simply not work.
And this is a basic necessity, as you said earlier, tied fundamentally to the right to life.
Right. And again, it's a really interesting international, from the lawyer side, international perspective, and there's been case decisions across the world, as you know, where courts have said the right to life means that folks have the right to food and shelter and medicines that they need to survive. And I do think at a real moral level, at a human level, we all understand that.
Mm-hmm. Yeah, there's a moral intuition toward that really is, I think, being pricked right now during a time of crisis. And I wonder if you could leave us with maybe a closing thought on what your prayer is for America during this challenging time, and perhaps going forward with regard to our access to healthcare.
Yeah, I would like to just close with some optimism. I think that we are all, and that would include me personally, this wasn't a top issue for me all of my career in adulthood. It has, and I wasn't necessarily understanding how important it was to have a collective, we the people, government guarantee. Sometimes in the US, people think, oh, government, that's not going to be the answer. But as we've seen, the private sector, the for-profit model that we've had, works worse than every other nation that is treating it as a government problem. So I think we're on a path, and sadly, I do think the coronavirus pandemic is pushing some of us along more of a path of realizing we can't keep going the way we're going. This is not just financially wrong. It's not just wrong from a public health perspective, but as we people of faith can articulate very well, this is morally wrong when our sisters and brothers can't get the care that they need and struggle and unfortunately even die because of that. So the more that we can raise that, the more that we can work. Again, I think in the faith communities have a very important role to play. Hopefully we can keep moving along the path to fixing this, and hopefully that happens sooner than later.
Well, I share your prayer that perhaps we can turn and find a better way, a life-giving way in the midst of this serious, very serious challenge. Thank you, Fran Quigley, for an incredibly insightful time together. Professor Fran Quigley of Faith in Healthcare, faithandhealthcare.org. Thanks again for joining us today.